they can lie down like that and become very, very stiff. So you have stiffness of the neck, and then with the kind of pressure that is brought to bear on the brain, it causes like the brain, like look at something pushing your brain down, fluid or inflammation pushing the brain down. It makes the brain push down to the brain stem, like the base of the skull. So that now it may affect your respiratory centers, it may affect the increasing intracranial pressure, could then lead to vomiting. So the children or the person affected can also start having some vomiting. And when it continues like that, the person may lose consciousness. So loss of consciousness may come, or the person may even start fitting. They have epileptic seizure disorder could set in, or the person's conscious state will get totally altered. He may not know where he is, and then typically they begin to hate light. So where there's light, so we call it photophobia. And where there is a lot of noise too, they don't seem to like noise, which we call phonophobia. So these are some of the symptoms that may come with somebody who is having the meningitis. In some cases, where if the person has a fairer skin or a light colored skin, some of the symptoms may be a rash that will come on the skin.
Let's use the tumbler test.
Exactly.
The glass.
But not in all cases. But some people may have this rash that is not like as if there's a bleeding under the skin. But if I have my skin is fair and I hit myself and it's red, I can just do this and it will go. But with this one, it's stuck and it's stuck there. If you put a plain glass on it and you roll it, I can press the plain glass on it, the blood will never move. So that is something that is typical of a meningococcal rash. So these are some of the symptoms that the person would experience. And sometimes the person becomes so stiff that when you try to move the neck like this, the person may have a lot of pain, or you try to move the neck and then the person may jerk the feet up. We call that the Brzezinski sign. Or sometimes you try to elevate the leg, the hip and the leg in the 90 degrees, and then try to extend the leg, and the person will wince. Even though the person may have an altered state of consciousness, may wince, showing that there is the transmission to the brain. He's feeling something, so there's a problem along the spine, and that is what we call the Koenig sign. So these things may be there, and it will lead to a diagnosis of meningitis.
How can it be prevented then? Is there any steps that we can take to avoid?
Well, I think the video spoke about a few of them, but especially in this time that we are going through the Harmattan, and that this year was really hard, or even for those of us in the south. I was coughing all over the place. I had a big toll on me. So it means that it will worsen the north. And this is the time that everybody needs to be cautious. And we should reduce the congestion in public places. We should be careful how we are coughing. If you are coughing, it's important to try and
hygienic
cover your mouth, and don't cough into the environment for other people to breathe in. It is also important that congestion in rooms, have your rooms well ventilated. Have enough windows, let air pass through. If you have a fan to use, then it's important that you use it so that at least when there is something in the air, at least it can go out. But where we have very close rooms, small rooms with 10 people in a room, then ventilation is poor. If there is any droplet out, anybody can inhale it, and then it will just spread. It's important also to know that this kind of somebody may just have a cough and cold, just a simple flu. And if for all you know, it may be a way by which it can be transmitted to the brain. People have tonsillitis, tonsil infection. People have simple sinus infections, and it's very close to the distance between the nose and the brain is very close. And there's a small plate between the nose and the brain with holes in it. So there's a simple flu. If it's by Haemophilus influenza flu, it could easily transmit into the brain. So that's how sometimes these things can spread. So around this time, when you have a cough and cold, you have a flu, don't take it lightly. You should take it very lightly and not spread it around. And it's important that you seek help in the medical institution as quickly as possible. And again, for our colleagues in the north, our friends in the north, they shouldn't be too superstitious about it. a lot of them believe it's the curse of the gods. You've done something wrong to the gods, and they are punishing you for that. But these things happen. I mean, we've had situations where like people, I mean, looking at the Saharan area all the way to North Africa. I mean, we had incidents where people, like maybe when you are going for the Hajj, they make sure that you have inoculation, meningitis inoculation, because you can carry it there or can carry it from there and bring it here, because people are going to crowd. So, and we have the type A, type B, type C of the meningitis thing, and then there's a one we call W135. These are the main cause of the epidemics. So they make sure that when you are going to travel, you are injected or given the vaccination against, because once you go there and cough with all these people at the house, you can just infect people so easily. So it's important that you take the necessary precautions, and also when you have symptoms of headache, severe vomiting, neck stiffness, please quickly as possible see the medical people, and then once you start treatment, you can save about 90% of people.
Okay, let's talk about treatment then. What would you do in regards to treating somebody with cerebral spinal meningitis? When
the diagnosis is made, and the doctor must be quick enough to make the diagnosis, because time is of the essence. Within hours or a day or two, a person can die from meningitis if interventions are not put in place as quickly as possible. So with the signs that I've given, the person comes headaches and fever and all that. Again, not all these things are malaria, but the person also complains about neck stiffness or difficulty moving the neck. The doctor would have a suspicion of possible meningitis. And I must say also that before I go into treatment, there's another type we call tuberculous meningitis. Tuberculosis, as we know, affecting the pulmonary, the lungs. We have abdominal TB. We also have what we call the TB of the spine, which I think we've dealt with before. Then there is another one that we call the tuberculous meningitis. TB can go all the way to the brain and affect the brain. And that one is sometimes doctors will even miss it, because we have to diagnose that with a very, very high index of suspicion, because you may just miss it. So there's tuberculous meningitis as well. Now, once a doctor suspects it, he would even wait for, say, that go and do culture and then let me wait for 3 days for culture to come. No, I will do it quickly and then start the antibiotics. If the culture comes and it's not meningitis or anything, yes, I think it's better to err on the side of caution than to say that I'm waiting for 3 days, because we are talking about 24 to 48 hours a person can die. So once the classic symptoms are there, neck stiffness, rigidity of the neck, and all these chemic signs, we start with very potent antibiotics, and in a couple of days the person is likely to recover. In the treatment thereof, sometimes there are other complications that the person may get from the meningitis. If we can have what we call the sensory neural hearing loss, eventually can lead to deafness. So some of these things are also taken into cognizance. So when the person is being managed, so it's the quick approach, the way the steady approach to it is very, very important to avoid any other complications that the person may have, I think deficits that the person may have after the person has recovered. So time is of the essence.
So what would you, when you start you admit them first straight away, start them on antibiotics, what other treatments would there be? With the antibiotics, the mainstay. Other things you do is to control the temperature, and the other thing is the inflammation is there. So another thing we employ would be what we call the steroids. Steroids to bring down the inflammation of it, because I think it's all over the brain, so we need to bring down the inflammation so that the brain too can be eased a bit. There are other things as you manage the person with other things coming. If there's a need to give the person oxygen whilst treatment, depending on each individual's case, you tailor something towards the person. Sometimes they have to look for alternatives. Something can even affect their respiratory tract, or can affect their respiration. So you tailor things according to the needs of the patient at the time. Somebody may have it and may not have that much difficulty as another person. Again, the person's immune system comes to play in how they respond to treatment. Some people who may have immunosuppression, diabetes, HIV, and other things may have other forms of bacteria causing the meningitis. They are those who fall prey to things like the fungal types that can cause the toxoplasma. Toxoplasma is a toxoplasma that can affect the brain, and that's for people who are really immunocompromised or immunosuppressed. So it comes in, take the patient handy. Other predisposing conditions that the person have would all be tailored into seeing the patient through.
Okay. Can treatment end up being expensive then? Because obviously, depending on what the case is like, and depending on how many parts that is affected, what's the average that treatment would usually cost somebody?
The antibiotic that is usually employed here for meningitis, if it's plain meningitis, usually we go for something called Rocephin.
Okay.
Rocephin is quite expensive.
Do you know if it's covered under the NHIS too?
Yes, it is.
It is. Okay.
The generic name is Ceftriaxone.
Okay.
Ceftriaxone is the original, whatever we call it, the patented one. This is what they call the Rocephin. But the Ceftriaxone is also expensive, but not as expensive as the
original one. But it is covered under NHIS.
Yes,
so if anybody's on the NHIS, they can get the treatment under that.
Yeah.
Okay. Dr. Bote, I want to say thank you for coming in, as usual, educating us more on cerebrospinal meningitis. This has been our Health Club, which is brought to you by Lipton.